Hi, everyone. We're going to get started in another minute. Thanks for joining us. Why don't we get started? We have a lot of people who've joined already, so thank you so much. My name's Marie Herb. I'm from the Technical Assistance Collaborative, or TAC, and I want to welcome you all to our HOPWA office hours. Today, it's focused on support services and hotel motel utilization. This is the third office hours that the Office of HIV Housing has sponsored. And really, these are an opportunity for OHH and its TA providers to present some key information, give you any policy and program updates, but most importantly, it's a way for you to get answers to some of the questions you have. If we can't answer those questions today, we'll get back to you, to everyone at a later point. So don't worry or don't get frustrated. Because we have over 200 people are on and more are joining, all attendees are going to be muted, but we do want to hear from you. So please put your questions in the Q&A box. We have some folks, Liz and Laura, are in the background, and they'll be watching that and really helping us get answers to those questions. If you have technical issues, whether or just kind of logistical questions, you could put those in the chat box, and Laura will be answering those. So in the chat box, just direct it to Laura, so everyone doesn't need to know if you can't kind of hear or access something. The webinar is going to be recorded, and at a later date, probably before the holidays, we'll be posting it to the HUD Exchange. Next. So again, I said I'm Marie Herb. I'm from the Technical Assistance Collaborative. We're joined with two people from the Office of HIV Housing. We have Rita Harcrow, who's the director, and Amy Palionis, who is a senior program specialist with OHH. Jacob Mahalik is also on the TAC team here. He's the principal of Sound Thinking. He'll be presenting today as well. And then, as I mentioned, Liz Stewart and Laura Harris will be helping us monitoring questions, answering questions, and making sure everything goes smoothly today. So with that, I think the webinar today, or the presentation, the office hours, we're breaking it up into two sections. We have, the first section is on supportive services, and the second section is on hotel motel vouchers or slides. We're gonna first do a few slides just to kind of set the stage, give you any updates, and then we'll open it for questions. So with that, I'm gonna hand it over to Jacob to just start off our session on the supportive services.
Thank you, Marie. This is Jake. It's my great pleasure to be here with you. I just posted to the chat the link to the Google Doc PowerPoint slide set that I'm using. You can feel free to click on that link and follow along, or if you are the kind of learner who likes to print it out and make notes next to the slides, you should be able to do that from the Google Docs link that I just posted there. So as Marie said, today we're going to look at two topics, supportive services and hotel and motel. We have about 10 slides to introduce each topic, and we'll have a first set of questions right after the support services slides, and then we'll have questions again at the end. So here we're looking at what are the supportive services that are allowed under the HOPWA program. And you can see the ones that are marked in red are the ones that are expanded or new as a result of the CARES Act and the expansion of the HOPWA program under that funding. For the most part, all of the activities that we're talking about are available to bill under all three types of HOPWA funds that are active right now. So this table looks at some of the key activities that we're going to be talking about and the funding streams. So let's look at the columns first. The first column is the type of activity. The second one says CARES Act. So these are the CARES Act specific dollars that have been awarded to the HOPWA grantees, both formula and competitive. The second column says designated FY20 funds. So as noted in the materials that have been provided by the Office of HIV/AIDS Housing, a portion of the FY20 basic formula grant can be designated to be lookalike to the CARES Act and can parallel the CARES Act activities. And then the fourth column there is the regular HOPWA awards. So that would be your FY18-19 funds that you're still spending down. And you can see that all of these activities are on this slide. Oh, there are some others are available under these funding sources. In the case of infection control, of course, that's covered by other sources, including FEMA, Community Development Block Grant, other HUD programs, and Ryan White. And so for infection control in particular, HOPWA asks to be the payer of last resort. So let's just go quickly through these key areas, and we'll pick up the nuances as we go along. This slide is on case management. And of course, the case management goal is to target assistance to make sure that clients have access to essential services, including food, water, medications, medical care, protective equipment, and information. More than ever, we really need to be paying attention to finding out about people's lives and assessing whether they have adequate access to the things that they need. And so to focus and target these case management activities may require updating or amending existing job descriptions and potentially doing some subcontracting to groups or individuals who can focus on case management, or dividing within your own staff, your teams, so that you have people who might be better at housing, doing housing stuff, and people who might be better at support services, coordination and things, doing that. We also want to make sure that these staff are able to deliver their case management services remotely, such as through telephone, Zoom, and other video activities. Meals and nutrition remain an important essential in people's lives. And so we're looking at highlighting contact-free forms of food delivery, including food banks, working with CSAs in your community, food boxes, and other kinds of meal delivery. And then, of course, the use of prepaid grocery store cards, food delivery by staff, volunteers, or other community services, food drop-off and pickup sites, whatever works best in your community for your clients. With transportation assistance, there's been a bit of an expansion regarding the use of privately owned vehicles, which can be used as needed to access food, employment, medical care, supplies, and necessary appointments of various kinds. And you can use prepaid gas cards or debit cards, other ways to get money into the client's hands to pay for their gas. And also we have the ability to pay for car repair. You'll see there in the first paragraph, car repair cannot be covered under regular HOPWA funds, but both the CARES Act and the designated FY20 funds can cover car repair. The purchase of protective supplies, of course, is allowed for both staff and clients. And we encourage grantees to coordinate with both the Ryan White and the Emergency Solution Grant programs, as they also have funding for these activities. And you can see here in terms of not on a person-by-person basis, but in terms of developing your budget and contracts, some ideas about what kind of documentation and description would be necessary to assure that the clients get what they need and that all clients are treated equally. Due to the need for all these remote services, there's both the ability to deal with cell phones and internet service. We'll cover them separately. So cell phones can be purchased, service plans and phone cards when when they're needed by clients to enable the provision of support services necessary to obtain and retain housing, or to ensure client safety and stability. These would be for mental health or other kinds of healthcare visits, as well as case management and other necessary social service activities. In the case of telephones that are being purchased, the purchaser is the project sponsor. The project sponsor retains ownership of the device. It's loaned to the clients. And when the public health emergency ends, the intention is that the phones will get returned to the project sponsor. And phone cards or minutes may be purchased for clients who already own a phone to help make sure that they can stay connected. Likewise, laptops, tablets, and necessary software programs can be purchased. Of course, the formula grantee will need to make sure that these are in the contract and approve the purchasing. This is not laptops for clients, but laptops for staff as needed. And as you can see in the bottom bullet, they'll be considered supplies, and there's guidance there in 2 CFR 200 for how to account for the purchase of computer and like similar equipment as supplies. We have 2 slides on internet service. So basic internet service is allowed, and based on the need for, again, connecting for all these kinds of service-related activities, including allowing household members to either work remotely or even go to school remotely. The internet service can only be purchased with the CARES Act fund or the designated FY20 funds. And this is a third-party payment. The payment has to be made directly to the internet provider. And then once they're approved, this expense would be on your support services line item. And there's a lot of detail here, but again, the project sponsor and grantee would need to document that these costs are necessary, that other funding is not available. There should be policies and procedures in place regarding all of the steps involved here, including the assessment of the need, the ownership, any kind of service limitations, time limits, and then at the end of the emergency period, the payment for the internet services would be discontinued, and or an arrangement's made for the client or some other source to pick up the expenses. This is just kind of a summary here that as with all activities under the HOPWA program, the grantees and project sponsors should agree upon and establish policies and procedures that are followed by all staff in all circumstances, that governs how each activity will function. And also all of the contracting, accounting, and reporting needs to follow the grant-based accounting rules, which, just to remind you, every expenditure needs to be tied back to a specific grant award. So whether it's the FY18, the FY19, the FY20, or the CARES Act fund, every purchase, every staff hour, everything that you do has to be tied to one of those sources of funding directly, not as a pool, but as a direct expense. And with that, we'll take questions for this topic, and I'm going to stop my screen share so we can see the respondents more clearly.
Thanks, Jake. And we do have a number of questions coming in. I just want to remind folks, it's just helpful for us to be able to answer the question if you put it in the Q&A box over the chat. So just make sure that you are doing that. So the first question, one of the first questions that we have is related to transportation. And the question is, can transportation funding under the CARES Act be used to help a client that lost employment due to COVID, find new employment, or once started a new job, go to and from work? I'm wondering if anyone on the OHH team can respond to that one.
I can take that question. So yes, transportation is a component of HOPWA supportive services and may be funded using either regular HOPWA allocations or CARES Act funding. Transportation can be provided in a variety of ways. You can pay for taxi or rideshare costs, bus or subway fares, transportation provided by agency staff, or directly purchasing gas or prepaid gas cards for clients. Transportation to search for employment and commuting to work once a job is secured are both allowable in order to keep clients safe during the pandemic.
Great, thanks, Amy. Kind of going off of that, you'd mentioned gas at prepaid cards, and one of the questions came up around gift cards. So I'm gonna go ahead and answer this live. And if anyone wants to take this, just let me know. Can gift cards be bought for food, gas, prepaid cards on the regular HOPWA funding?
I was muted. Yes, you can use that on the regular HOPWA funding. And just a reminder that when providing grocery store or other, gift cards to clients for food purchases, it's important to put in place methods to restrict purchases to food items or other similar controls whenever possible. And you should use careful tracking methods for food purposes and think through any policies needed on waste, fraud, or abuse.
Okay, great. This is another one for OHH, I think. What are project sponsors expected to do with the phones or the tablets after consumers return them post-COVID?
I can try to answer that one. So that equipment is governed by 2 CFR 200 regulations. So if you've purchased burner phones or equipment that was utilized for just for the period of COVID, you could recycle those, use them within your agency, and check your policies on how you're complying with 2 CFR 200 on the plans for those pieces of equipment.
Okay, great. Thank you. Another questioner asked about car insurance payments, and this question, I don't think it's come up in the past webinars we've done and some of the Q&A on the AAQ. So OHH is going to get a response on that. But I would say in the meantime, the guidance has been if someone falls behind on their rent because let's say they were making their car insurance payments, they would be eligible to use STROMU for that. So that's one way that you could still provide assistance to that household, but we will get a more definitive answer on the car insurance payments.
And Liz,
Sorry, Marie, you went mute.
Yep, I don't know why. I just put my email in the chat box that if it's helpful, as you can tell, OHH really works hard to make this work. HOPWA is a very flexible kind of open program. So whoever asked the car insurance question, if you can just provide a little bit more information, you can email me and then we can then work with OHH to see what's possible. So that's the mherb@tech Inc. in the chat box.
sorry, Jake, let me just chime in. Depending upon the insurance company, you can adjust the billing cycle. And so you can get monthly billings on your car insurance. And a lot of us pay up front or whatever. So it's also worth talking to the insurer because they don't want to lose the clients and they want to be flexible to keep the business going as well. So there may be an opportunity to reduce the current level of payment or, something, just remember to include them in the conversation if it's helpful.
Great, thanks. I think for this next one, it is around supplies. Jake, maybe, I think you would probably be able to answer this one. Can funds be used to pay for supplies such as cleaning supplies, thermometers, etc., for project sponsors or just eligible households?
Yes, both staff and client coverage for cleaning supplies and other protective equipment and things can be covered under HOPWA funding.
So Liz, looking at questions, there's one that was put in the chat, but just a reminder, if people could put in the Q&A, then we'll be able to kind of track those better. But it was, what are the guidelines when paying for car repairs? And I think one is, and you've already heard a few times in some responses, the need to have some policies and procedures. So you want to just make sure you're creating those and being as clear as possible. But and we will, at the end of this, talk about an office hours that are just on creating policies and procedures. But Jake, Rita, or Amy, anything specific about what, what some of the guidelines might be related to car repairs?
I think you'd want to show in your policy that the need for car repair is related to safety of that household or the household member during the COVID crisis. So if the personal vehicle is the safest way for that household to be able to travel, you want to be able to document this makes sense because of the pandemic. And that's why we're looking at CARES Act specifically for this. And you'll probably hear this more than once during the supportive services webinar. There are a lot of things eligible, but you do have to still consider your overall budget. So if you're paying for extensive car repairs, how does that impact your overall budget to assist other people with their other supportive services needs?
Okay, thank you. Here is another question around eligibility. Can HOPWA supportive service funds be used for clients that are not currently enrolled in HOPWA for housing assistance, but they are engaged in HIV case management? Any takers on that one?
I can answer that. So yes, supportive services funds can be used for anyone that's eligible for HOPWA. So anyone that's low income and HIV positive. Supportive service funds can be used and you can provide services for them. There's cases all the time that are folks that are receiving housing assistance through Section 8 or another subsidy, but are getting supportive services through the HOPWA program because they are eligible for HOPWA and need that support.
Great, thanks, Amy. And I think some folks, just to get some clarity on when you're using your CARES funds, how are you supposed to be documenting the required verification that's tying the funds being expended to the CARES fund versus the other grant funds that you have?
Liz, I'm sorry, can you just repeat the question?
Sure, sorry. What is the required verification tying the CARES funds to our clientele?
What we've said in general is that you don't have to have a certification, anything that the client would sign saying, that they're experiencing issues related specifically to their infection or a family member's infection or so on. We know that there's a pandemic in this country. So, some of your verification may be that to say, this is related to the overarching pandemic that's impacting our community. If you're looking at a specific, like the car repairs, we would need something in the notes explaining the, for example, if this is a household who normally takes the bus, but now that is not the safest method, or the bus may not be working on the right schedule, and therefore there's car repairs that could be made and get this person safely to employment, then that's the kind of documentation you would want to have in your client notes. And Amy or others may have other thoughts. That was just an example that came to mind.
Jake here, just, anticipating that both the grantee may want to look at what the project sponsors documentation files look like. They're required to do that on a regular basis. And also the field office may also be doing some kinds of chart audit or review. If you're planning on billing something against the CARES Act or the FY20 designated funds, the word COVID should show up in a note that says you've authorized something. It should be there, because otherwise there's no reason why the CARES Act funds would be expended on that rather than the regular FY18 or 19 funds. And also the staff person who's doing the work in their summary of what they did during the period that they're billing, if all of their time is related to is being billed against either the CARES Act or the designated FY20 funds, they should be mentioning the word COVID in their description of what they've done.
Jake, and I just one other example that I'd heard about that I want to be clear. We're trying to, you do need to make the case, as Jake is saying, and make sure the words are there. So if you get monitored, you can have that evidence in the notes and so forth, and in the timesheets. On the other extreme of that, we've heard some community examples where a person in need of additional assistance, rental assistance, who had first they had their hours cut at work, and then they ended up with the job lost. This particular provider was asking for the employer, or then the former employer, to provide a letter that spelled out that the loss of the employment was due to COVID-19. And that required this person to go back in physically twice because the technology wasn't there to get the letter. And that's more than is necessary. Remember, the important thing here is, verify it and note it, but try to keep people safe and don't ask them to go back physically to get additional documentation.
Liz, before we move on to the hotel and motel, which I propose we do in just a minute, can I address the question that was asked regarding the thumb drive? The question was asked, if someone is working on employment and they want to get a flash drive or a thumb drive so that they can keep their resume with them and then access not just one computer, but any computer. And I would say that this is a very sensible purchase. It's not a lot of money. It's really a supply. It's not a piece of equipment. And you should buy it and give it to them. Don't ask for it back, and hope that they work hard to get their job. That's in accounting, we talk about a concept called materiality. And in the big picture that we're talking about, the cost of an individual thumb drive is very little. Please help them get the job.
And I think there was a separate part of that question on, can we purchase interview clothing, pay for work, shoes or boots? And the HUD guidance so far has been that those are not eligible costs under supportive services. So OHH, unless that you think that's going to change.
No, I mean, those are really just, considered personal items that have not historically been allowed under HOPWA. We definitely always encourage you to, try to leverage those and make partnerships in your community for resources for those items. I know that there are, organizations that do provide those types of resources. So it's really just important to make connections in order to get your clients access to those.
And I'll just ping back to what Marie had said earlier about if there's a specific issue that maybe we're not thinking about that's related to COVID-19, if you would send an email, so that's something that we could try to figure out, like how does that fit into the language of the CARES Act. But it's not clear how that would be different now than just with your general HOPWA.
Great, thank you for that. Jake, I'm wondering if right before we move on to hotels, motels, a few people have asked in the questions, wait, are we talking about CARES Act? Is this regular HOPWA funding? If maybe you want to just move real quick before we move on to the section up to that chart that outlines the expenses and which funding sources they apply to, that might be helpful again.
Sorry, I had to unmute. Yeah, so again, there are, I'll use my cursor. There are 3 types of funding: the CARES Act, the designated FY20 funds, and the regular HOPWA awards. I apologize, this slide does not include the internet. So the internet would only be in the CARES Act and designated funds, and car repair would only be in the CARES Act and designated fund. Amy, are there any other things that would only show up in designated? PPE?
You know what, we have a more detailed chart on this. I'm actually gonna, I will copy and paste a link in the chat.
Great, thank you.
Everybody has that.
Okay. Great. So Marie is going to present the hotel motel slides, and then we'll come back and we'll answer questions on both hotel motel and support services. We just wanted to introduce the second topic. Go ahead, Marie.
Great, thank you, Jake. At some point in the chat box, Andrew had put the words prevent, prepare for, or respond to COVID. And when the CARES Act funds were passed in the spring, the idea for hotel motel, or the need for accessing hotel motels, really came to the forefront. Again, for a community to be able to prevent, prepare for, and respond. So hotel motel utilization, you as a grantee or a subrecipient of the HOPWA CARES Act funds can rent hotels, right? So with the idea that you are, and we'll talk about who's eligible, but really trying to keep people safe, right? So if people cannot stay in a living situation, maybe a group home, maybe an apartment with their family, if either they are at risk or their family members, then you are able to access the hotel motels in order to keep them safe. Hotel motels could also include Airbnbs, so it doesn't necessarily have to be a structure that says hotel or motel. It could be something more creative or more possible. Many of you may be working in rural communities, and access to hotel motels might not really be available. In general, OHH would like to see the stays as not exceeding 60 days. But if with demonstrated need, it's possible to make that argument, that case, that someone needs to be in that hotel motel unit for a longer period of time. Nope, you can go back, Jake, to the eligible activities in HOPWA. Where are we here? Nope, I think.
Yep, I'm there, got it.
Okay, thank you. So if you think about now kind of running this hotel motel option out of your program, there's going to be a variety of different costs. And we did a whole webinar on hotel motels, which you can access on the HUD Exchange too. So my presentation is just going to be brief. But as far as thinking about cost, there's the cost of renting the units, right? The room from that hotel. And that would be a leasing line item. Then you may have staff costs, and those might be related to 2 different things. So the cost for staff to negotiate the hotels, to find the hotels, to work with the owners of those hotels, those would be leasing costs. So you would put those under the leasing budget line item. But the cost to have case managers maybe come to the hotel, to do Zoom calls with the occupants of the hotel rooms, those would be things that you would bill to supportive services. So you just need to be able to track what the activity is that that staff person is doing. With the CARES Act and designated funds, not regular HOPWA funds, you could actually cover hotel motel damages. So as you think about going out and maybe negotiating with a hotel, they might be a little apprehensive about a program. But you could, if you're able to secure with them that you could pay for any damages, that might alleviate some of their concerns. And then if you have the indirect cost from your agency, again, this would be kind of in line how you're probably billing it now. Either, if you have an approved indirect rate from a federal agency, or if you're using up to the 10%, you would do that in the same kind of way. And then just if you are providing other supportive services to the occupants, just like you may have done before using the hotel motel, that would be billed to supportive services as well. So you just want to look at kind of the whole package and make sure, you're not just putting someone in a unit and leaving them, that you're really kind of providing the full package of services. Jake, thanks. So just some guidance is, that you ideally will be negotiating with the property owner. And that might be a chain like a Marriott, maybe there's a Fairfield Inn or so in your community. Or it might be with an individual owner of a small hotel. Maybe it's just a 10-unit little privately owned entity, or as I said, Airbnbs. But what you want to make sure is that you know what both you are getting as well as the person living with HIV or their family member are getting when you put them in. So, are they getting housekeeping, and how often will they be getting housekeeping? Is there laundry on site? How are you going to be dealing with meals? Even hotels that had been, like, say, providing a hot breakfast during COVID, many of those shut down. So really, how are you going to address their meals? If they have on-site parking, do they charge for that? Do they not charge for that? Is Wi-Fi included? In general, I'd say it is, but actually often they, may charge you to access that. So can you get that kind of included in the room rate? And those other items, and just thinking through what are the kind of amenities that you might want to negotiate into that. There may be other kind of hotel, motel programs being run in your community as a result of COVID. These might be funded by the Federal Emergency Management Agency. They might be funded by your continuum of care or using emergency solution grant funds. So if those are out there, it'd be great to link with those because one, you don't want to be competing for units. So the more that you can have a cohesive approach to owners, the better. And if you are, kind of thinking that this is something where you'll be using lots of units, not just a handful, there are actual services out there that, typically were targeted to businesses, right? So if Verizon would have a service because they'd have lots of employees traveling all over the country. But now a lot of business travel is not happening. So these corporate lodging services are available and can help you negotiate those rates in your community. So that might be something to do. Again, just really as much as you can outline what you're getting for that room rate and sign contracts and have that all set, the smoother your program will be. Next. So who's eligible? Again, it's any person who's eligible for HOPWA. So if the household income is lower than 80% of area median income and at least one family member is HIV positive. This can include people who are not currently getting HOPWA services. So maybe that household, that individual was kind of living and doing just fine without any HOPWA funded services prior to COVID, but now COVID has kind of created this additional need. So you can start serving them as long as their income is at 80% of area median income. If they are living in HOPWA funded housing, you can still help them with these funds. Again, you may need to help isolate them from other people living in that housing, and that's totally appropriate. In addition, if it's a family member, so the person is not the person living with HIV, but you need to isolate them from the person living with HIV, that's also an eligible recipient of the hotel motel program. I already mentioned that, in general, the standard guidance is that assistance would be for not more than 60 days in a 6-month period, right? HOPWA, it's housing opportunities. So OHH is all about really finding housing for people. But given that this is a COVID emergency and there's lots of health and safety concerns, clearly this pandemic has lasted longer than any of us thought. You can demonstrate that there is a need for this assistance to be greater than 60 days and have the participant, their household, stay in that hotel or motel for more than 60 days. Again, you'd want to document that. You'd want to really outline that in your policies and procedures when you're going to allow that to go beyond the 60 days. I think that is the end of the formal slides. Oh no, where did that one come from? Okay, so we did say that we could use the leasing line item to cover damages. Again, this is a good negotiating tool in order to get hotel owners to agree. You want to lay out what are the policies and procedures, and you want that in the agreement. What would you pay for? I have to stress that the damages cannot be covered out of your regular HOPWA funds. It would have to be either out of the CARES Act funds, or if you designated FY20 HOPWA funds for COVID specific uses. Next. Okay, now we're at questions. Liz, were there any questions?
Yeah, there's been a few coming in, and thank everyone for putting those in the Q&A box. So the first question actually is a follow-up to the damages question. Marie, you were just talking about damages.
Mm-hmm.
Can HOPWA funds be used to cover clients' damage to hotel motel rooms using CARE Act funds? And are there any limits on how much can be provided?
Let me take that one, Liz. So the answer is yes, for CARES Act, specifically, you can cover damages out of your leasing budget line item if you have that in your, have funds in that line item. So as far as exactly how much, again, that goes back to what we've said earlier about policies. You want to make sure that you have policies with limits and recognizing how, the ability to pay for extensive damages for the same person repeatedly could impact your ability to assist others. And you have to weigh all of that, it's challenging, but we need to make sure that there's, equity in the way that we're working with all of our assisted households. And you also want to think about how those kinds of limits might impact, or those policies might impact your relationship with your local hotel and motels that you're able to work with as you're housing people during the pandemic.
May I jump in?
Yes.
So a couple of quick things. One is leasing is a new activity for certain jurisdictions and certain for competitive grantees. And so in order to actually do this, you have to have leasing in your approved budget and scope of work. And so it will probably require an amendment to a consolidated plan for the formula grantees. And then you have to work with your field office for the competitive. So it's possible that places didn't think they were going to use hotel motel at the beginning of the pandemic and now realize that they need to. Just remember that there are steps that are outlined in the guidance, and there was a prior webinar on this, and there's also a fact sheet and some other stuff. So we're not going to get to all the details of hotel motel today, but there are more resources in the HUD Exchange. Please find them and utilize them. There was another question about the difference between leasing and resource identification. So just quickly, remember that leasing is a housing activity. resource identification is a strategy and an activity to identify additional resources for housing for the clients. It's not housing itself. So that's the simplest way of differentiating between those activities.
And the one thing I wanted to add to the damages question is, kind of flipping it, that you just want to also protect your agency and the program participant from, any false claims that they've created damages. So, in the housing world, if you were doing tenant-based rental assistance, there's an inspection that's done. So there's kind of a whole report that the unit passed certain conditions. With a hotel motel, you don't have to have those inspections, but you might, if your staff is able to go to the hotel motel, it might be okay to take some pictures or have the program participant just kind of take some pictures or have a quick checklist of things that are in the hotel. Was there a TV? Check. Did it work? Check. Those kind of things, so that, they're not accused of creating damage when the unit may not have passed prior to that.
Okay, it looks like we had another question around limits, and I think Jake and Marie, you kind of already answered this, but maybe not specifically. So just to reiterate and make sure everyone is clear on any limits, what is the approved maximum daily rate? And I'm assuming this is related to staying at a hotel or a motel. Is there a maximum daily rate?
There's not one that's published. That's a great question, though. Because I'm sitting here in Boston and hotels probably cost more here in Boston than they would. I know Rita's, somewhere else, and it might cost more than where she is. So, and often, like when you travel, say, on a federal contract, you have to you can't exceed what's the federal rate that's available. That might be one thing to check, right? And Rita and Amy, stop me if I'm going off track here, but you can check on the Government Services Administration what kind of rates are. That would be a maximum almost, because I think, again, during COVID, that a lot of hotels are really available at an incredible discount now. So I think it's just showing that you've made a good effort to find the best rate that you can. If you're in a community and there's only one hotel, you're going to be limited in how much you can look around and negotiate. But if you're in a community where there's multiple, it would be to your advantage to do some due diligence, kind of check what are available rates, and just keep track of all of that. But I don't know, Rita or Amy, if you have anything else you want to add.
I was just going to mention, I think that's a good point that you made about when employees travel or whatever, that we always tend to look at that approved rate. And remember that your 2 CFR 200 regulations still apply, even under CARES Act. So that there's a standard there for cost to be reasonable. So, you want to make sure that you're looking at what's reasonable for your community. And there are other, I can't remember, is it reasonable, eligible, and I can't think of the
Allocable.
other. That's
Allocable,
it.
yeah.
So those standards apply. So just remember, you have to think of what's reasonable. And once again, look at how that fits into your overall budget.
Yeah. And I would add, with Priceline and Google and everything, you can compare rates pretty quickly and understand which hotels are in the higher segment of the market and which ones are in the lower segment. But also remember that we're doing this for the safety and health of the residents. So you don't want to put them into a drug-infested hotel because it's a little bit cheaper, right? So remember, people in the hotel that will be typically on their own. And if they're going to go out, it should be a safe neighborhood. If they're if they're trying to navigate a life, that they're able to do that safely.
Okay. And I think that answers a question someone put in the chat around whether you could use the GSA rates for the area. It sounds like you could look at those, but you also need to look at the local area and ensure that there isn't a huge discrepancy between those to ensure that it is reasonable. We had another question come in around Wi-Fi and whether or not HOPWA can cover cable TV and Wi-Fi. And I know that this is a question, Jake, that I think you could respond to, since a lot of billing, the way it works is like the cable TV sometimes is bundled in with the internet services. How will that work with this new guidance that just came out?
Sure. So the questioner also is 60 years old. So anytime you're a senior, there are oftentimes breaks for being a senior. And I assume that if a person hasn't explored that on their own, a case manager can help them. It's also true, depending upon where you live, you can't get just internet services. The internet can be bundled with cable. To the extent that it can be separated, then you would try to separate it. But never would HOPWA approve of Disney Plus or any kind of extra sports programming or anything that's purely entertainment. That would never be approved. And so again, due diligence, documentation, reasonableness, all of those things come into play for this activity as well.
Great, thanks for the clarification. Next question, I'm going to go back to some of the questions that came in earlier under supportive services. So folks, please continue to submit questions around hotel motels, but I think we've answered most of those. I'm going to go back to questions we hadn't gotten to yet. So one of the questions around pots and pans. Can we purchase a set of pots and pans for residents who do not have these items or other household items through the regular HOPWA grant?
I can take that. And so really that just depends on the type of activity that's being provided. So for clients in scattered site housing, tenant-based rental assistance, STROMU, things that aren't project-based, unfortunately, you can't use HOPWA funds for those types of personal items like pots and pans. We strongly recommend in those situations that you try to find those resources elsewhere through donations or partners with or other organizations that can provide that. For project or facility-based housing, for housing projects, master lease units where those items would stay with the unit and continue benefiting the program regardless of which client is living in that unit, those are eligible. Those would be under operating costs. So it really just sort of depends on whether it would be a personal item that stays with the client and is just given to the client, or really, program supplies or furnishings for your project-based housing.
We did get a lot of questions that came in more around the car payments, cars, whether you can pay for the car payment, where you can buy a car. Is there anything, OHH, that you can add around those types of car costs and whether or not they are eligible with any of the funding sources that we've been talking about?
I can start answering this and Rita can jump in. No, paying for a car note or purchasing a new car is not eligible under any of the HOPWA pots of funding. There are ways that you can be more creative if you're seeing that transportation is a need for your clients. Your program can purchase a van and provide transportation to folks. Again, you can pay for public transportation. I know that's not always an option everywhere, but purchasing vehicles for your program in areas where there isn't a lot of transportation could help clients. Also, if the client is eligible for, if a client needs help with their car payments but is eligible for STROMU, maybe you could pay, the full amount of their rent and utilities for a few months as they're able to, maybe make those car payments. trying, more creative options like that. But unfortunately, no, you can't use your HOPWA funds to pay a car note or, just outright purchase a car specifically just for one client.
I think that covered it, Amy, and really good case management can come into play here into linking that household to the other supports that are available in the community that might free up that money for car payments. And I think insurance came up too, and that also fits into that category.
Okay, so here is an eligibility question. I have a client who is not receiving specific HOPWA funding, so is not someone that's currently enrolled in a program, but has an HIV/AIDS diagnosis and meets the income requirements. Should we qualify her to receive the CARES Act funding? Are there any other specific documentation needed for auditing concerns if we were to serve this person?
No, we actually anticipate that, if I'm understanding this question right, we anticipate that you will see new households presenting in need of assistance, all different kinds of assistance, because of the impacts of the pandemic. So they don't already have to be enrolled in your program, whatever that looks like for you locally. They have to be eligible based on HIV status and income.
Okay, great. Go ahead,
Hey,
James,
Liz,
sorry.
can we pull up the question about STRMU? Because it relates to the 3 different streams of funding and how to stage that. So the question is, does CARES Act funding have to be used specifically for COVID-related issues? Or can it be used for regular STRMU if all STRMU funds have been spent out? Rita, I saw your expression.
I was actually looking for the chart because I think that were you asking to roll back to the chart. I'm not sure I understand this. I mean, if a household qualifies for STRMU and it's during the time of COVID,
Yes.
That's what we're talking about. So STRMU, it would make sense for that household.
Thank you.
That does remind me of something else, though, where I was looking back for the chart. So when you think about, we've talked about this, and I think Liz, you brought it up too. The money that can be sort of identified in your formula grant for CARES Act type of activities. That money. So the formula money in your FY20 cannot be used until you've depleted your CARES Act money. So we want to make sure that you're not using your regular HOPWA formula award for that, that it's that portion that you've declared as necessary for the response to COVID-19.
Okay, and that there was another question that someone had asked around paying for property taxes for STRMU clients. Are those eligible?
I can answer that. So basically, if the property taxes are rolled into the mortgage and that's one payment, yes, they can be paid that way. But if we see sometimes where folks have a mortgage that's actually paid off and they're just struggling to pay their property taxes, unfortunately, the funds can't be used to pay standalone property taxes, but they can be used if the property taxes are part of that monthly mortgage payment.
Okay, and another question that came up around hotel, motels, and toiletry items. So I think that would be considered personal items. If the hotel motel contract does not include toiletry items, can these items be purchased for a client with supportive service funds? So is there a distinction between something like pots and pans versus sort of hygienic items?
I mean, in the past, we've said that those types of items are not eligible. But as Rita mentioned earlier, as we are hearing these things more often as a need, this could be something that we could revisit and provide guidance on. But just as of right now, the answer is that, historically, we have not allowed funds to be used for those types of personal items for clients and that they should be leveraged. I don't know if Rita, you have.
The only caveat I can think to that is if it might qualify as something like PPE. So if it's something
Right.
like, soaps or things to keep people clean and healthy, then certainly that might be a little distinction that you would use there.
Yeah. Although I would say, Rita, I have never in my life stayed at a hotel that didn't provide a bar of soap. It might not have been
Well,
soap
right.
it might not have been soap that I liked, but it was there. So
That's
I would say this is something I would push this back to the project sponsor. And if you're negotiating with the hotel, make sure that you know what they're providing. And if they aren't offering to provide it, get them to provide it rather than putting a burden on each individual client to find their own soap and shampoo. Especially if we're trying to help them stay safe, the extra trips to the store are not a helpful step towards staying safe.
That was an important distinction that Rita made, that cleaning and disinfectant supplies and things like that, they are eligible. But it's just a lot of times we get questions about, sort of like welcome baskets or sort of housewarming things of pots and pans and towels and those types of items. Just unfortunately, those have been considered, personal items in the past, and we strongly encourage folks to get those through donations or leveraging.
And I think an important point too, when we're thinking about hotel motel, is if the person is going to be staying in the hotel motel because they have tested positive for COVID and just need to isolate from their family or other household members, that you may not want the hotel to be in there doing daily cleaning and laundry service and all. So that's something you'd also want to negotiate with the hotel, or if you need to buy some supplies to have them in that room, that would work as well. But it's something that you're going to want to think about. And then Liz, I saw in the chat, so you may not have seen it, is someone asked a question about hotels again, that could a person with on HOPWA or a person living with HIV who's now in a cancer trial be put into that hotel for safety? And I'm not sure exactly what the details of that are. So again, you can always email, but I think the core issue is that it's as long as it's to prevent, prepare for, or respond to COVID. So if that being on the cancer trial makes them more susceptible, if they need to isolate from family or friends because of COVID, then I'd say that, is eligible, that it's less about being on the cancer trial and more about their vulnerability to the virus.
Thanks, Marie.
Yeah.
We had a few questions come in regarding STROMU, and I just want to, I think we're happy to answer this question because we have time. Just remind folks that there were separate resources on the HUD Exchange for some of the STROMU specific questions, but we do have time. So we're going to go ahead and try to answer as much as we can. This question is about utility assistance and it being tied to people in permanent facility-based housing and TBRA. Wanting to know whether or not you can assist a household with STROMU assistance to pay for utility assistance if they are already enrolled in a permanent facility-based housing or TBRA.
Well, the short answer is it's a perfect time to do a new rent calculation for them based on their current income.
Yeah, so we get these questions a lot about folks struggling to pay their rent or utilities because there's been changes in income due to COVID. And with changes in income needs to come a recalculation of their rent payment. So we sort of want to stress that people are performing those recalculations when folks are experiencing losses in income and not expecting their clients to continue paying the same portion of their rent even after they've had a change in income.
Okay, great. Another follow-up on StromU. Are we able to pay client utility bills even if they do not have a past due balance?
Yes. There's no requirement that the rent or utilities or mortgage be late or overdue in order to pay those costs.
Okay, this next one is an interesting question around pots and pans. So Amy, you kind of already articulated that if a project sponsor was using the pots and pans in a facility-based housing, then that could be an eligible cost because it stays with the program. Whereas it wouldn't be eligible if you're paying it just for the client for their own personal use. This question is, if we are facilitating a living skills class regarding cooking demonstration, can we purchase pots and pans, kitchen items to demonstrate properly?
See, I was looking at the one about incentivizing them with the pots and pans, which the answer would be no, because that would just be a gift to the clients for attending the classes. Yes, I think in that situation, and it stayed with the program, that would be considered supplies for the life skills training. It's really just, is it staying with the program, and is it benefiting clients in the program, not just being given to specific clients as a personal item?
Okay, great.
And can't be used, and those types of things can't, those types of incentives, such as giving folks pots and pans for coming to the demo, although that is a creative idea, unfortunately isn't allowed.
And can I just add something here? Like, really think about if you're having a cooking demonstration right now, that may be a really bad idea. We're, in a surge of COVID-19. So I just want to remind everybody, it's the idea behind CARES Act is to make sure that people can stay safely apart and be healthy. Cooking, yes, that's important. But bringing people together for something like this doesn't make sense.
Correct. That is a good point, for sure. But that's probably not the best focus right now. But just in general, in normal times, and you're doing life skills training, yes, that would be eligible.
Or if they were able to do the class virtually or something.
Correct.
They had
Yes.
to get the pots and pans for that. That would
For
be
sure.
acceptable.
Yes.
Okay. I think we've covered a little bit around documentation, but always good to hammer it home since we do have time. Is there any specific application or paperwork for clients to fill out if they're going to be, being assisted with CARES Act funding, or any kind of specific language that needs to be used in the files? So the question is, what application or paperwork does a CARES Act client fill out?
All right, I was looking back to see, because I think we've talked a little bit about this already. What we've said is there doesn't have to be like a specific declaration. A person does not have to sign or disclose anything about their COVID-19 status. So that's the documentation that you're talking about. But there should be a connection to, the requirements of, the cost is eligible because it's something that's related to the pandemic. That can be a more overarching community-wide kind of impact. We know employment's down because of the pandemic. There's certain things that we're all experiencing collectively that we don't have to have that one-off where you have to have something signed or notarized saying this person lost their job because of COVID-19. But you should make a note of that kind of documentation. And you guys may have other, on the panel, you may have other examples of how providers are documenting that connection.
All right, just Rita, I guess also to get to your, or along with your overarching, justification is, someone, you don't need to specifically tie someone's specific job loss to the pandemic. But a justification of providing, STROMU to a client is that them losing their housing right now or becoming homeless would put them in an unsafe situation because there is a pandemic going on and could, contribute to them not being able to stay safe.
And you may want to think about how you're wording that in your policies too, right, Amy? So they could say, as a result of the pandemic impacts in our community, we are implementing this policy around STRMU or whatever kinds of things that you're doing that are significantly different than your normal practice. And then you could point to that in your notes as well.
It looks like there was a question about rent increases, and there are a number of questions people have about eviction, landlord-tenant law, and all that. And it's important to note that all leasing is local. All rental agreements are controlled at the local level. And so unless there's a local injunction against a rent increase is allowable anytime the landlord wants to, right? That's how the private housing market works. And if there's a decent relationship between the tenant and the landlord, a negotiation can be made about the rent increase. If the landlord has a conscience, they may realize that raising the rent when people are short of money is not a community oriented activity, but there's nothing that the HOPWA program can do to stop a landlord from increasing the rent. Rent reasonableness will continue to be important. And unfortunately, there may be some cases where a person needs to move because the rent exceeds all the limits that are allowed in the local area. However, I doubt that that would be forced during the COVID period because of all the waivers and stuff that's in place. So my general guidance is there's no way to specifically answer a general question because it's a general question. Each case needs to be handled separately, and it should be handled by the most astute people that you know.
We got another question around gift cards, and Jake, I think you talked a little bit about this when you were presenting, that it's important to really carefully document the use of gift cards, and this is sort of about actually getting the gift card. When using gift cards, can we socially distance their delivery through the use of mail service to deliver the card to the resident? Can we use other methods instead of client signature to document card delivery and use? Can two individuals witness the mailing of the card to document the card existence? Any thoughts from the group here around that one?
I love this question. I think one thing, I think you can mail if you need to mail. Make sure it doesn't look obvious that it's a gift card in that envelope, I'd say is one. You could ask the recipient to, take a selfie that they got the gift card on the other end. And I think then, just tracking, keeping a sheet that I mailed it to Jane Doe on this date and Jane acknowledged receipt of it on this date. I think that's, the best you can do. And again, HOPWA will know that, or OHH will understand if, some things get lost in the mail, but you don't want 100 of the gift cards you've mailed out to be lost in the mail, right? So you, again, just want to do the best you can.
Great. We had another question come in around loss of income and proof around loss of income. So if a client who has no legal status loses their employment, how can you provide proof of loss of income if they get paid in cash? Is self-certification of zero income acceptable as proof of income and or loss of income? So are there any changes around, the hierarchy of what you'd look at as far as verification of income?
I mean, my take is if someone has zero income, that they can self-certify that they have zero income. That it's hard to document something that doesn't exist. So a self-certification would be sufficient, and you can, figure out again in your policies and procedures how you get that documentation in a safe, remote-like way.
And we have a a sample self-certification of income form that I can link to in the chat.
Great.
I would say, if you think the person is trying to defraud you, and in fact, they do have income, but they don't want to tell you about it, you certainly can take steps to verify that there, in fact, is no income, although you may not want to do that. You definitely don't allow yourself to be defrauded if possible.
And I know there was a question about utility allowances and utility costs, and I think we may just need some more information from the person asking that. So again, I'll put my email in the chat box, and if you can email me so we can find out some more info on that question. Because again, that would be really, if we're talking utility allowances, we're talking tenant-based rental assistance. So I just want to make sure we know what the question is and not give you any of the wrong information.
We're not finished, but before people drop off, let me just show the last few slides. So I'm going to go back to SlideShare. First of all, want to point out to you that we have 2 more webinars next week. The first one on Monday at 1 p.m. Eastern Time, December 14th, looking at reporting requirements. There's new guidance from the Office of HIV/AIDS Housing, OHH. And the second is on Wednesday next week, also at 1 p.m. COVID-19 related policy and procedure development for HOPWA grantees. Both of these will cover both formula and competitive grantees. Here on the next slide, we've mentioned the HUD exchange extensively today. You'll see here on the first bullet, there's a way to sign up for the mailing list, and anytime something is HOPWA or COVID-19 related or other topics, you can get an email. We also have online HOPWA program resources listed here in this next slide. Again, we will be sending out, we will be posting a copy of these slides as well as the recording for today. So you can get these resources, the set of these slides, if you haven't been able to access them through Google Docs. We also have the HOPWA Ask a Question portal. So any question that comes up after today, you can send it into the portal, as well as there's a methodology for accessing technical assistance. Does anybody, other panelists, want to add anything in terms of information or resources? And then I'll stop the screen share.
Nope, just I think just really going to the HUD exchange has kind of almost everything you need.
Okay, so back to you, Liz. Are there further questions?
There aren't any questions that I don't think we've already covered in depth, either through presentation or the Q&A so far. Again, some of that, you guys had a lot of good questions, a lot of questions that I think OHH wants to consider a little bit further and hopefully provide additional guidance to you. So again, feel free to email Marie at the email address she provided. I also encourage everyone to take a look at the chart, that the link that Amy put in the chat box. It really is great. I know we all don't necessarily have printers right now, but have it saved on your desktop and you can quickly look and see which eligible costs fall under which funding source. I think that's a helpful thing when you're kind of managing these different grants right now. With that, I don't think there's much more. OHH, is there anything else that you wanted to say before we all sign off?
I'll just add, we've in these office hours looked for information back from you all about what other kind of information you need that would be helpful. A lot of the questions we get in are nuanced and specific to what you're dealing with, and we do try to go back and respond so it can be helpful to you specifically. If you're dealing with something that's sort of a one-off kind of question. But if if you have other ideas or something that you just feel like you really need to hear more about in office hours, we would like to hear from you. So please plug that into Q&A or into the chat. So we can try to make sure that these office hours and webinars are responsive to what you need to hear.
Yeah, I see that Abigail is asking for best practices and policies and procedures. Yes, that's exactly what we're looking at next week. And if you have a particular topic, Abigail, or anyone that you want to see covered next week, and if you let us know in advance, we'll communicate that to the presenters so we make sure that your specific question is considered in the preparation of the materials.
And there was another comment about emailing the chart that Amy had referenced and Liz then just referenced. What we'll do is we'll add that link to the back of these slides, and everyone who's attending today is going to get a copy of these slides anyway, so the link will be in that. And I think Liz just copied it again, but we'll add it to the slides.
Thank you for
And
that.
really quickly, as Jake just mentioned, we have the webinar on policies and procedures next week, and someone else had also put in a question about reporting. So there are 2 webinars next week that will have some really important, helpful information on them. The first one is on Monday, and that is on CARES Act reporting. And the second one is the policies and procedures webinar that's on Wednesday. And so if you're not registered for those yet, go to the HUD Exchange and please register for them.
And we know we're jamming in a lot of information right before the holidays. Hopefully you can make them, because when you're participating live, then you can ask questions for yourself. But worst case, if you can't, all of these office hours will be are recorded and will be listed and posted on the HUD Exchange at some point. But again, it's always helpful if you're on, because then we could hear your questions directly.
And Hanukkah starts in 2 days, so happy Hanukkah, everyone.
Thank you, everyone, for coming
Thank
today.
you.
We'll see many of you on Monday. Bye.
See you Monday.
Bye-bye.
Bye.